Hello. Let's see if we're up. Is everything working? Are we live? Making sure that you can actually hear me. Hello, folks. I'm back in the United States, if you can't tell, because I am back in my home studio. No longer, it is 6:30 in the morning at a hotel in New Zealand. So, great. Newbold One says we are live. It's good to hear. I am feeling very spicy today, as a warning. So thanks to Aaron's viewers that hopped over from here. It's good to see you. Please be prepared. I've got a lot of spicy feelings this morning. I've essentially spent the past 2 hours reading an enraging lawsuit, and you are going to hear about it. I am going to try, I am not a lawyer, so I am not going to dive super deep into the technical side of it, but essentially this is a lawsuit filed in the federal courts in Texas by the same person that archetyped the Senate Bill 8 in Texas, which is the one that extremely restrictive abortion law that bans all abortions after 6 weeks. This is not about abortions, though. What this is about is specifically about PrEP, which is the type of drug that is used by people that are at risk for HIV, that are HIV negative, in order to prevent transmission. And essentially, because it seems like the way that we are destroying people's safety and the mechanism by which conservative Christian extremists are trying to go after the rights of folks that don't fit their narrative of a moral life, is by dismantling pieces and access of healthcare in the United States, which is already an incredibly fragile and very broken system. We're going to talk about this case that is essentially trying to find a way to, introduce a public health crisis by making things much worse than they were before we had access to pre-exposure prophylactics, or PrEP as it is called, for HIV transmission, which I would like to remind everyone is, in fact, HIV is a pandemic. It is an infectious disease, and we are all of us, it does not matter your sexuality, your race, your national origin, your relationship status, we are all affected by infectious disease pandemics. And it is important to remember and understand that. Anyway, like I said, I'm feeling spicy. I'll do a little bit more of introducing that concept, but that's what we're going to be talking about today. And I think it's important and relevant to talk about it in the context of how we are seeing a lot of these healthcare legal decisions lining up, because even if you feel like you might not be affected by any one of these individual cases, just like I was talking about how you might not, a couple weeks ago, I was talking about the really disappointing Supreme Court decision around dialysis that was overshadowed by other Supreme Court decisions about healthcare in the United States a couple weeks ago. Even if you are not receiving dialysis, even if you are not someone in end-stage renal disease, which is most people, it is, it is not the most common of things, which is part of the reason that it does have special carve-outs. It is important to understand that these dismantling and attacks on healthcare affect the integrity of our already broken and fragile American healthcare system, and they have repercussions for you, even if you are not currently in the category of people that are being targeted by Christian religious extremists via the court systems. And, one of the areas that we've also seen recently, which theoretically the Biden administration has tried to step in to prevent, which is people with rheumatoid arthritis or lupus, other autoimmune disorders that use methotrexate as a treatment for their autoimmune disorder. Methotrexate, which does not work for me, but which I have previously had to be on because it is considered a first-line treatment for rheumatoid arthritis, for lupus. For a lot of people, it is an incredibly effective treatment. It is also commonly used in combination with other drugs like mine, which is, for example, my drug is a biological drug. It is commonly used in concert with other drugs to effectively treat a lot of autoimmune disorders. In fact, it was originally used as both a chemotherapy drug and an autoimmune disorder. However, it is also used in the treatment of ectopic pregnancies, which are pregnancies that are not viable and threaten the health of the mother, which is essentially a pregnancy that is implanted outside, an embryo that is implanted outside of the uterus, therefore is non-viable. Methotrexate is a drug that can be used to treat ectopic pregnancies. It is usually one of the first-line treatments. And because of Roe v. Wade coming down, quite a lot of patients that are receiving methotrexate as their regular treatment for autoimmune disorders have been having to deal with doctors being unsure that they can prescribe those anymore. Some people that are receiving methotrexate as part of chemotherapy for cancer treatments have been pulled off of it because they are a woman of childbearing years and doctors are worried about the legal risk to themselves. And theoretically, Biden's administration has tried to put out an emergency ruling that essentially says that you have to cover methotrexate if it's for abortion fashion uses. That being said, you being health insurance companies and that doctors have to be able to practice medicine in the way that it is recommended. But it's like everybody knew that this consequence is going to happen. And this just once again points out that like you might not be in the category of people that are at risk for HIV. I hope you're not. You might not be in the category of someone that is in a relationship with someone that is HIV positive. You might not be, living a lifestyle where you are at risk for HIV and therefore access to PrEP drugs seems completely irrelevant to you. But there are a ton of ways in which this type of court attacks dismantling healthcare in the aim of religious extremistness and in economic terms, which is how a lot of this court opinion has been argued, is from the perspective of not religious folks, even though it was filed by a lawyer who likes to author these often successful religious extremist lawsuits and court opinions. It is important to understand that there are consequences to making it so that people can make the argument that they don't want to cover healthcare for other people in a health insurance pool because of economic arguments, because of religious arguments, because this affects us in lots of ways. For example, my drug, I like how I said I was going to like introduce the donut or something. I'm not even paying attention to the chat. I just have so many feelings. So the thing to understand about all of this is like, there are a bunch of ways and reasons where we can see this have even more detrimental effects on access to healthcare in the United States if we see more of these cases have success. Because let's say someone has a sincerely held religious belief that I shouldn't have access to my biological medication. My biological medication is derived from hamster ovary cells, which I know plenty of vegans that would not like the idea that hamster ovary cells are in use. Almost all injectable medications in the United States are tested with horseshoe crab blood, which is this cool blue blood. I've talked about it on previous live streams. Horseshoe crabs are forced to donate blood. And it is required for almost all injectable medications that are distributed in the US under FDA because essentially it tests to make sure that the injectable drugs are not bringing bacteria in that will kill you, which is theoretically good. There are synthetic tests that would be good because horseshoe crab blood is, it's not great for ecosystems to pick up horseshoe crabs and make them donate blood and then re-release them. We have a lot of evidence that it does have effects on both their lifespans. Not to mention that horseshoe crab blood is very expensive. Like all animal inputs are very expensive for things. So who is to say that there isn't, for example, the Seventh-day Adventists, which is a vegan group that believes that animals are unclean. They are a Christian fundamentalist group, and they believe that animals are unclean and therefore are vegan. Who's to say that they couldn't have a religious belief that makes it impossible for me to get access to my medication? Additionally, the way that this is going out attacking is it's going out attacking essential health benefits. And the list that has come up from the Task Force on Preventative Diseases through the Department of Human Services as ensured in the Affordable Care Act about what are the good treatments for preventative health care. And guess what? That same thing has been attacked when it comes to limiting the cost-sharing provisions for my drug. This stuff is already happening. Health insurance companies will strive, and they will find any way, including people's religious liberty, in order to not cover things that cost them money. So anyway, I have feelings. I have so many feelings. Okay. Nils says, it's a miracle that such a drug exists. Totally insane to block the use of it. I like... So much of HIV and AIDS activism in the 80s and 90s was all about making sure that there was research for drugs. And then it was once the AVT came out and the other retroviral therapy came out, then it was about access to the drugs. And suddenly, we now have a freaking miracle drug. I mean, pre-exposure prophylaxis, PrEP, there's essentially 2 brand names of it. It's generally called PrEP, is 99% effective for people that are that might get HIV through sex. 99% effective at preventing the spread of HIV. So that is people having receptive sex with receptive anal sex with a partner that has HIV or has an unknown HIV status, and it is 74% effective at preventing HIV in someone that is receiving vaginal sex from a partner with an unknown or positive HIV status that is uncontrolled by the other, antiviral drugs for HIV and intravenous drug users. It is so important to talk about the fact that the reason there is a list of preventative care that needs to be covered under plans under the Affordable Care Act is because it matters to all of us. Why do we want to prevent HIV in people? Because, well, from purely economic terms, besides the actual terrible toll that is HIV and AIDS on lives, is that guess what? Guess what? It's really expensive when people have HIV. It's much better to prevent it. And it's just, I can't even. Well, anyway. New Bold One says it's just the clipping of wings after clipping of wings, mainly in the arena of sex, but elsewhere too. No, quite honestly, it's anywhere when it comes to U.S. healthcare, it's anywhere where it's expensive. Religion and morality around sex is a really convenient way to do it, but quite frankly, it's used in lots of arenas. Christopher says HIV is still real, just no one is talking about it anymore. And it's very real, and lots of people talk about it, but there are people that are in risk groups. Guess what? A lot of those risk groups are busy pouring all of their defense into getting things that we've already been able to ensure are covered under healthcare. It's just like a constant fighting of things that we've already fought and relitigating of that. So Latitudes is when I started meth. I'm not sure you want to phrase it that way. We call it MTX usually. When I started methotrexate, they asked if I was on birth control, and I really didn't think it was related, and I don't live a red state, but it's still very, very scary. So I actually, when I was on methotrexate, in addition to having to sign a pledge that said I would be on 2 forms of birth control, despite the fact that I was not engaging in sex that would have any risk of getting me pregnant, I had to say that I was on 2 forms of birth control in order to even be prescribed methotrexate, and I had to watch this whole video about all all of the side effects for methotrexate. This is also common for people that are on Accutane, which is the brand name of a acne drug. There is this whole thing. Go look up iPledge if you want to see this like kind of mildly scary website that is entirely devoted to preventing birth defects in people that can get pregnant that are on Accutane, essentially. And it's pretty much done by the pharmacy companies that don't want to get sued. Latitude says, I hate being on methotrexate, but I would be extremely upset if I couldn't fill it. Yeah, my mother is on methotrexate and has her tubes tied and was like, can I argue with them? Like, can I be the lawsuit? That anyway, yeah. Christopher says, thank you for recognizing it is something at the hands of religious extremists. Throwing out the babies with the bathwater is just not right. It's not just throwing babies out with the bathwater. It's fundamentally trying to dismantle the entire healthcare infrastructure that we barely built. I mean, American healthcare is so screwed up. It is so expensive. We have such a weird, once again, I'm writing a book about it right now, so I'm very mired in the inefficiencies of the American healthcare system. So I might feel more passionately about this, but it just because I'm in it all the time. But it is trying to chip away at the few wins that we've had in the healthcare arena in the United States. And yes, it is at the hands of religious extremists, but it's also at the hands of healthcare companies, health insurance companies trying to find a way to limit coverage, including most of the essentially plaintiffs in this case were not religious, and they were doing it on the basis of economic grounds, right? So, I mean, this lawyer goes and cherry picks his plaintiffs because you can do that with public interest law. Normally, you can't solicit. Latitude says, totally skip the donut. I am paying attention. Okay, well, thank you for the prompting. It's going to be hard to show up on camera today, but this is Marionberry. You can't really, it looks much darker on camera than it really is in person, but essentially it's a Marionberry glaze, and then it's a chocolate cake donut, and it has cacao nibs on the top. Yes, I know I don't like chocolate very much. I'm hoping this will be good because I have found, one, I like Marionberry, and two, I have found that the chocolate cake donuts are not overly chocolatey for me, like frosting or something. So I'm hoping the combo of flavors will work. Newbold One says, hamsters. Oh no. Yeah. Well, hamster ovaries are used to create Intercept, which is what I'm on. I don't really understand it because I am not a science person. Philip says, the biological shot I get each month, essentially enabling my lungs to also work, also from hamster ovary stem cells. Only side effect is I crave cedar shavings. That's great. I've never found myself craving cedar shavings, but you never know, right? Eric says, it makes no sense to attack or punish a class of people based on ignorant and poorly informed politicians' very hazy notion of healthcare needs. It's a form of terrorism. I agree. I very much agree. Philip says, retail price for my shot is $8,000 per shot. After my $1,300 monthly premium for insurance, cost to me is $120. Sigh. I am sorry. I'm sorry. My drug is, actually drug prices go up in July every year. I don't know if people know that, but that's when they publish their new lists of drug prices. And my medication is $12,000 US a month as list price. And I've done several episodes on my medication, and all of that. $120 could be better, could be worse. If you are interested in dropping the brand name of your drug, I'm always curious to kind of break down how different specialty drugs, especially, move through the U.S. healthcare system, and I might be able to do a live stream talking about specifically things that are going on there. Christopher says, why are we taking care of people with HIV? Why is that even a question? Well, let me talk about it. Okay, so why is that a question? Well, because religious fundamentalists be out here trying to narrate everything the way that they want to. Okay, so essentially what happened is that the same lawyer that authored, this is why I'm big angry, the same lawyer that authored the Senate Bill 8, which is the extremely restrictive abortion bill in Texas that bans all abortion after 6 weeks, which is before a lot of people know they're pregnant. Um, he and he used to clerk for Supreme Court Justice Clarence Thomas. He also used to be a former Texas Solicitor General, so supervising and approving all legal appeals for the state. So he's like a pretty fundamentally powerful lawyer. He is now running his own law firm in Texas, and pretty much what he is doing as that law firm is helping state legislators draft bills, including the abortion ban, which empowers private citizens to report abortions that run afoul of the law. He also, like, he's a lawyer. Essentially, it is important to understand that this dude has the ear of some people. He also, we're not going to get into it today because I'm talking specifically about healthcare, but he also doesn't have a current lawsuit against Obergefell versus Hodges, which is what brought down Defense of Marriage Act and made same-sex marriage the law of the land in the United States. He issued an opinion essentially saying to Clarence Thomas almost directly that Obergefell versus Hodges should come down. But he doesn't actually have any current working lawsuits. But specifically, that opinion is fundamentally kind of on the basis of Roe v. Wade being overturned. And I know I've mentioned, a lot of people are extremely concerned about Obergefell versus Hodges kind of being next up to bat, and that same-sex marriage is coming down too. So that is an important thing to understand, because they've said, oh, it's settled law when it comes to same-sex marriage as well. So he filed a case. The case is Kelly versus the United States of America, and it was filed in federal court originally in 2020. However, it's been accelerated by Roe v. Wade, and more like appellate briefings have been added to it. He represents several clients who object to the Affordable Care Act's mandate that insurance providers cover, among other things, preventative medication specifically for PrEP. So PrEP, what it is a daily drug or a irregular, like every several weeks, injection that you would take in order to prevent HIV infection for people that are at risk for it. What is important to understand is when we say that, when we're looking at Roe v. Wade, a lot of people are like, oh, it is about control of women. It is about policing women's bodies. And while I very, very much agree with that, it is important to understand that it is setting the stage for policing the healthcare needs of anybody that doesn't fit a narrow definition of what is either economically feasible or what is moral. PrEP is almost entirely used by biological men. It is 96%, I believe, used by men. I think only 4% of those who filled 4.7% of those who filled PrEP prescriptions were female in 2016. 44% of people that use PrEP are Black and 25% of Hispanic. So when we talk about access to PrEP, we are talking disproportionately about young men of color who are mostly gay. And then there's also a category of people that are sex workers, transgender women that are at risk for HIV for other reasons, and then intravenous drug users. There are people who need PrEP who are not in this category of homosexual behavior, and that should be freaking irrelevant. But it is important to understand that when we are talking about access to PrEP, from this fundamentalist religious perspective, because there are people that are at risk for HIV because they are in heterosexual monogamous relationships with people that are positive for HIV. Those people may or may not be positive for HIV because of behaviors like intravenous drug use or homosexual activity, as the religious folks like to say. I don't think it's relevant one way or the other why you are at risk for HIV, because the point of healthcare is not to morality police why someone is at risk for a disease. The point of prophylaxis pre-exposure is to prevent the spread of HIV, which is a public health crisis. So, worldwide. So that is the entire point of it, and it doesn't matter whether or not someone fits your moral standards. However, the arguments being made in this lawsuit, which I would like to say I read the whole freaking thing, and I got myself real angry, which is why I'm feeling so spicy. It is like absolutely important to understand just how much they are trying to set up every possible argument when it comes to being able to fell this. And let's look at the definition of health insurance. What we are doing, we are paying into a pool to insure ourselves against the risk that we have a healthcare need. So we're contributing to a greater pool, and it means that people, when they need it, can access the pool of funds, and you are paying in with the idea that it will reduce your future personal exposure when it comes to healthcare costs. Why is health insurance necessary? Well, it's necessary because we all use different amounts of healthcare and need different amounts of healthcare throughout our lifetime. It's also important in the United States, where we have the highest healthcare costs for the worst outcomes. We have the highest healthcare costs in the world. So even things that would be simple or easy or inexpensive to treat out of pocket in other countries can make you bankrupt in the United States. So why do we have health insurance? Well, it is a shared risk pool. Before the Affordable Care Act passed, it was extremely possible to deny people health insurance coverage because you said that they were too risky to add to the general pool. A common way that this was done was using pre-existing conditions to disqualify people. So I am a great example. One of the reasons that I didn't have health insurance for so long was because I had a pre-existing condition and I was uninsurable unless I could get it under certain kinds of plans that were required to cover me through an employer, which was really challenging before the Affordable Care Act, when they were required to offer it. And one of the things was that they would just say, oh, that's a pre-existing condition, we will not cover that. Because I have rheumatoid arthritis. Rheumatoid arthritis is very expensive to treat, partially because the drugs are so expensive, but also because prior to those miracle drugs coming out, the lifetime chance of disability was extremely high. Arthritis is the leading cause of disability in the United States. So it is important to understand the framework of why we choose to have health insurance. One of the other ways that they could deny someone from a risk pool wasn't based on their individual risk, but a risk called a community rating. And a community rating meant that it was very hard for certain professions to get health insurance because when they got health insurance, it was very expensive for them to get health insurance because of the risks to that occupation or to that zip code for different health issues that are costly to treat. One of these examples is that hairdressers had a lot of trouble getting health insurance or would find it very expensive because the community rating for hairdressers is very high. Why is the community rating for hairdressers very high prior to the ACA making community ratings illegal? Well, because the large share of hairdressers that were gay men and therefore were at risk for HIV. So we have had this kind of bias built into the system for an extremely long time. And the ACA made it so that it was possible for people like me to get healthcare. Another example of a community rating would be it would be very expensive to get health insurance for people that worked in coal mining. Why? Well, because turns out miner's lung is a thing. And the risk of the different types of lung issues that you can have and other issues that you can have from exposure to coal mining meant that it was very expensive. And that is one of the reasons that coal mines tend to be heavily unionized, because a lot of that union fighting was for either, coverage for accidents, but also for health insurance. Eric says shared risk pools, the bigger they are, the better they work. Spread the load, spread the risk, everyone benefits. It's like voter rolls. If everyone has a right to vote, everyone benefits. Correct. Perfect description of all of this. I think it is important to understand why shared risk pools exist, so that we understand what happens when we start carving and picking away at people that don't want to cover essential life-saving healthcare for other people, which is essentially what this freaking Kelly versus the State of America court case filed by this lovely lawyer is doing this. Christopher says, why is the chat cut off at the bottom? I think we don't have the current screen settings on it. So it's important to understand this when you're looking at this case by this lawyer, Mitchell. So this is the whole argument. We come back to this original question that got me off on this. I think it is important to, when we're asking the question of why are we taking care of people with HIV? Why is that even a question? Well, here is the arguments. The Mr. Kelly, Mr. Starnes, Mr. Maxwell, and Mrs. Maxwell also object to contraceptive coverage and the coverage of PrEP drugs on religious grounds. Each of these plaintiffs is a Christian, and they are unwilling to purchase health insurance that subsidizes abortifacient contraception or PrEP drugs that encourage or facilitate homosexual behavior. One, we've already talked about the argument that PrEP is used by people that are not homosexual, and it shouldn't be relevant anyway. Two, I think what is important to note, while we are looking at this, and this is definitely founded under, this is based on religious fundamentalist Christian extremist views, and that's why this has been filed, the same way that, we have the exception to contraceptive coverage for nonprofit employers of a religious nature, or closely held private employers like Hobby Lobby, who filed the original contra Burwell versus Hobby Lobby stores that destroyed access to contraceptive coverage as a part of essential health benefits for essentially privately closely held corporations like Hobby Lobby that have religious objections to covering contraceptive for employees, or for folks that are under nonprofit religious employers. Contraceptive coverage is exactly part of the essential health benefits. So if you did not want to pay for contraceptive coverage and you did not work for one of those employers, like a church that was able to have access to healthcare plans, you would have to go out and try to find a plan that didn't have that coverage. However, there was very limited availability of those on the marketplace, because for most people, those were not ethical or legal. So one of the arguments being made here is, by mandating this coverage as part of the essential health benefits as preventative coverage, what you are doing is making it so that employees or anyone that is a health insurance provider or a health insurance participant of a plan might be subsidizing something that they morally object to. I would note that there are quite a few ways in which so HIV drugs fall into a bunch of special categories, similar to dialysis, like what I was talking about the other day. HIV drugs have more protections because of the Ryan White program, because of the expanded Medicaid coverage. But HIV drugs are usually for someone that is positively diagnosed with HIV, not someone receiving PrEP. That being said, there is a lot of manufacturer coverage for PrEP, and now it has to be, as of last year, it has to be covered with no cost sharing provisions for the actual drug under the ACA. So, why is this important? Well, there are a lot of drugs that there's a lot of medications, there's a lot of procedures that may be morally opposed to by someone. Hepatitis C, for example, is the people that are most commonly at risk for hepatitis C are people that have alcoholism or people that have intravenous drug use. End-stage renal disease is something that you are at risk for if you have liver disease, or end-stage renal disease is liver disease, is something that you're at risk for if you have alcoholism, as is any kind of liver failure. And there are plenty of ways in which you can make moral objections to someone getting life-saving care simply because you have decided you have moral objections to it. But what concerns me a lot, because you shouldn't get to choose whether or not people access life-saving care because you're morally opposed. We see these with these, so essentially, you can opt out of having to have health insurance and buy it on the marketplace if instead you get a Christian health sharing ministry. I'm not going to dive into too deep on those simply because I've covered them before. And honestly, I think the Last Week Tonight with John Oliver episode on healthcare sharing ministries is more important and does a better job than I ever could, because they have a team of researchers and they also set up their own health sharing ministry. But one of the things that I would always caution people that would be looking for these health sharing ministries, which are not health insurance and are not bound by the Affordable Care Act, is that they could make all sorts of arguments about how they were morally opposed to covering your health care because of any objections. Like, for example, if you got in a car crash and you were hit by a drunk driver, they could say that they refused to cover it because they had moral objections to drunk driving. There are a ton of ways in which these moral risk hazards we've already seen in the marketplace. But the thing that worries me, all this to be said, I think not to ignore that, because all of that is very concerning. But the thing that really concerns me is a ton of the plaintiffs in this lawsuit that was filed, which, by the way, has not gotten to the Supreme Court yet. This is in federal court. It will probably go appeal. And hopefully won't get taken up by the Supreme Court. That being said, former clerk for Justice Thomas, and they seem real keen on dismantling access to life-saving healthcare right now in the Supreme Court. So it is important to understand that so many of these plaintiffs were actually just people that weren't going to utilize the healthcare. So several of these plaintiffs were people that didn't want to cover contraceptive care, didn't want their health plan to cover contraceptive care because of increased costs, because they had a hysterectomy, because they were past childbearing age. So they feel like they should not have to pay for a healthcare plan that covers contraceptive options for other people because they don't need it, which defeats the entire point of a shared risk pool, which is the basis of health insurance. Several of the plaintiffs in this case were small private businesses like dentist offices or something like that, where they were making the argument that by participating in a healthcare plan that is required to cover PrEP, it raised the cost of their healthcare, and it made it so it was not optional for them to choose what applies or doesn't apply to the deductible, which is part of the essential health benefits. Although they've found a way to get around that with copay accumulators. Moving on. They were making the argument that they have to pay more for health insurance because it covers things that maybe they don't need for any of their employees. So the economic arguments are extremely worrisome because money rules how health insurance is in this country. Both arguments are very concerning, but they're all included in this case because they're trying to attack access to life-saving preventative medication on moral grounds, but they're coming at it from every angle that they can. In Montreal, I'd say about half my patients with Hep C were IV drug users. The other half were elderly patients who were recent immigrants from places where the water was contaminated. See? Great argument. Here we go. Woo! Also, I will note that I believe in South Africa, 30% of people are HIV positive, as the highest HIV positive rate in the world. And this is a great, note to make where we see this immigration policy interacting with healthcare policy in this country. And we are one of the few places that does not require, because we don't have a national healthcare system, we are one of the few countries that does not require medical exams when you are coming into the United States as an immigrant. Tuberculosis is endemic in certain countries in the world. Malaria is endemic in certain countries in the world and is not in the United States. And we could see that this argument starts to interface with immigration and national origin discrimination lawsuits if we are really saying, oh, we don't want to cover things that are too expensive, right? Because, for example, treatment for tuberculosis is very expensive, and it is also an infectious disease. And a lot of people will have latent tuberculosis. I think it's like 2/3 of the world or something has latent tuberculosis, but it is not endemic in the United States. And latent tuberculosis is not infectious, but if it converts into active TB, then it is infectious. So it's just really important to understand. Philip says, I'm agreeing that current U.S. healthcare is broken, hard to elaborate in short chat message, and must be available to all, must not discriminate. I mean, here's the, I don't care what moral arguments you have. This is an infectious disease thing, so it is at risk to you regardless. I am not too young to remember the panic that if someone, bled in school, if you didn't know their HIV status, that you might catch HIV from them in a pool. There is just so many ways in which you need to understand and recognize that this is a public health crisis. David says kidney disease. I think you were trying to fill in for the things that I was having trouble saying. Latitude says, wow, our entire system is so extremely hacked up and has been for a long time. Well, I think that's the thing that is really scary, is that just like Roe, which had existed for 50 years as a constitutional right to access abortion care in the United States, there are so many things that we thought we had already litigated with the Affordable Care Act. And we thought there were a lot of things that we thought we had fixed, even if the system continues to be extremely broken. I mean, obviously, I think the system is extremely broken. I'm writing a whole book about how to try to survive under the system. I have countless personal experiences with how broken the post-ACA system is, but there were a lot of things we thought we had, and instead, they're getting chipped away bit by bit. I don't think anybody thought that access to preventative drugs for infectious diseases was going to be one of the things that comes out from here. But another thing I want to emphasize is that the essential healthcare benefits require, without cost-sharing provisions, a bunch of different immunizations. So one of those immunizations is now the COVID-19 vaccine. Additionally, quite a lot of other vaccines. Well, you can refuse certain immunizations on religious grounds on a personal bodily autonomy basis. However, there are people that are opposed to certain immunizations because at some point they were made from fetal line cells. And it is a public health measure that we have immunizations available to everybody under essential healthcare benefits, because if we don't have herd immunity, look what happens. We have a lot of historical reasons why it is good for the economy, why it is good for people, why it is good for, just life, to have control over infectious diseases that we know are, in fact, that we know are able to be controlled with herd immunity, with immunizations, which is why we require them to go to public schools, why we require them to work in certain healthcare settings. And we want those to not cost anything. We want those to be part of the benefit that you get for paying for a healthcare premium every single month. And there is plenty of ways in which we could start to see the chipping at and the dismantling of access to immunizations because you happen to work for, I don't know, a craft store that has religious founders that decided they don't want to cover the COVID-19 vaccine, the one that has some of its origins in fetal cells. Jenny says TB is actually very common in Montreal. I wonder if that's because of Montreal's high immigrant population as well. I don't know about Canada's stats. I'd be interested to know about that. TB is very common among intravenous drug users, HIV positive patients. Yeah, it often goes side by side. That's actually one of the big concerns, right, when it comes to a lot of these things. I think that there is a good and interesting story here as well about PEP. So PEP is post-exposure prophylaxis, and it's for people that have possibly had a sexual assault. I don't know how to say that in schmexual. I was trying to not get flagged by the YouTube algorithm. That have had one of those that have been exposed to HIV, and one of those categories is healthcare workers, social workers that are have accidents at work. And there was a very good video. Let's see if I can find it so I can link to it in the comments. But it was the experience of a doctor who grew up in Canada. They happen to have a YouTube channel. He moved to the United States for work and had a HIV exposure at work. But he was relatively new at navigating the health insurance system in the United States because he grew up under a sane healthcare system. I'm not saying Canada doesn't have its issues, but it is fundamentally more sane of a healthcare system than our system. And he had to argue as a doctor who needed PEP, which is essentially a drug you take for 28 days. It's a combination of drugs you take for 28 days after possible HIV exposure in order to prevent HIV from settling in your body, essentially. And it reduces it significantly reduces your risk of contracting HIV, especially if you had unknown HIV exposure or you had known HIV exposure. And finds out if he has, I'm trying to find the video. So he did an entire video about his arguing back and forth about, it's called Chris Finds Out If He Has HIV, and I will put it in the chat here. So he essentially had an exposure at work during surgery and needed PEP, and he had to argue back and forth about what was covered as an essential health benefit under his insurance plan so that he could get access to PEP, which is a combination of drugs that are pretty expensive under the American system. Jenny says 3/4 of my TB patients were intravenous drug users. The rest were immigrants for patients where TB is rampant. Yeah. Newbold One says, I recently read about the monkeypox vaccine in Harlem, where most of the people who were able to book a shot were white. There are so many access issues everywhere, aren't there? Yes, correct. There are access issues with everything. The monkeypox vaccine is, I have been trying to follow it because it's kind of fast moving. It's very fascinating because essentially they didn't have any resources to put towards getting the word out. So essentially the people that got the word out were people that were able to go to a random clinic in the middle of the afternoon and found out about it through networks. So yeah. Jenny says, I had an HIV patient who was a racist shit and would purposefully spit blood at certain healthcare workers. Exposure risk was high. See, this is a great example of you are exposed in certain professions. You could have a community rating that is much higher for those kind of professions. The highest cost for hospitals in the United States after salaries is in fact the self-insurance of their own workers for health insurance, which is ironic. And self-insured doesn't mean they are the healthcare provider necessarily for their employees. It actually, self-insured is what is used to refer to essentially generally large employers that have a healthcare plan. It's administered through a health insurance provider. So you'll have a card just from Blue Shield or United Healthcare. But self-insured essentially means that they are the ones kind of bankrolling the costs, but it is administered by the healthcare company. That's an oversimplification. Self-insured plans fall under some exceptions under the ACA. Anyway. Philip says, thank you for talking about this. Looking forward to your book. I have to get back to my video editing tasks and hoarding cedar shavings. Well, if you ever want me to talk particularly about your drug, I would love to dive into the economics of it. Thank you for joining. We should eat this donut, huh? I'm really getting feelings. Yeah, the book's going to be around in like 3 years. So no, its publishing is slow and it's a graphic novel, so it'll take a while. Okay, Fuzzbubble says, you referred to Hobby Lobby as closely held. Does it not refer to being a public company? So public companies, I do not believe can qualify. I think if you were a public company, but then majority of your shares were closely held by the owners. Let's find out the true definition of closely held. Yeah, so essentially, while corporations are considered people in the United States, corporations, unless they were a nonprofit corporation that was a religious corporation like a church or a 50C2 nonprofit that was a religious corporation, they are not allowed to refuse access on religious grounds because the corporation is not allowed to have religious beliefs if they're a publicly held corporation that isn't closely held. But a closely held corporation would essentially mean like it is a corporation where more than 50% of the value of its outstanding stock, directly or indirectly, is held by 5 or fewer people. And Hobby Lobby is in that category. So you could theoretically have a public company if 50% of it was owned by one person, but I think it's usually meant for only stocks that are privately traded, because you essentially can't have a public offering and have more than 50% be owned by one. That's like not possible. So it would be like over-the-counter markets or, like you can still sell stock in a company without it necessarily being publicly traded. But yeah, no, publicly traded corporations are not able to fall into this exception, so they have to be closely held. Philip shared the drug here. Thanks. Yeah, I would love to cover it. I've been diving into some of the different drugs and the economics behind them, particularly Trikafta recently. I've been doing a lot of reporting on, which is used for cystic fibrosis, and it would be very fascinating, and it's $280,000 a year. So yeah, it would be interesting to talk about that. Ash says, late to the stream, guess I'm here just in time. Jenny says, oh my gosh, that necklace is beautiful. Okay, I'm gonna pay attention to the conversation now. Thanks. This is what I wear when I just don't feel like I want the chest exposed. That's really its primary, but it makes me feel a little bit like an Elizabethan collar. You know, it's like a modern day Elizabethan collar. Newbold One says, Hobby Lobby, the same company which bought stolen artifacts because their founder is a Christian fundamentalist. Correct. And like tried to sneak them in through shipments in Hobby Lobby. All right, should we eat this donut, y'all? I missed so much chat because I have so many feelings on this, and I don't even know if I covered all the stuff. I have so many notes because I read this whole thing and I just got slowly enraged more and more. One last, this is one of the legal arguments they were making. So from the lawsuit, the court should at the very least declare that US 42 USC 300 GG 13A1 is a matter of statutory interpretation, requires insurers to only cover the items or services that had an A or B rating from the US Preventative Services Task Force on March 23rd, 2010, the date in which the Affordable Care Act was signed into law. So the way the Affordable Care Act works with defining these preventative health benefits, these essential health benefits as preventative drugs, is that they have a U.S. Preventative Services Task Force, which is required to be experts that are independently appointed in order to evaluate if drugs should be considered preventative drugs, and they give them A, B, C ratings or whatever. And drugs that have A or B ratings are required to be covered as preventative healthcare medication under the essential healthcare benefits. I've already talked about how autoimmune disorders are not actually covered under this because autoimmune disorders just got sneakily taken out of preventative healthcare benefits, which is why my drug is not considered to be covered without cost-sharing provisions. But this is a fundamentally terrible argument when it comes to healthcare because there are a lot of drugs that have come out in the past 12 years. If you say that preventative drugs and immunizations that were developed or approved and proved to be effective for preventative disease only apply after if they existed on March 2010, what you're doing is preventing any innovation in preventative healthcare by essentially saying we don't have to cover it. Like, all of these people that make their arguments that are absolutely outrageous, pharmaceutical patent law in the US is arguable based on like, oh, we need it for innovation. There's something to be said for patents for healthcare medications can, in fact, encourage pharmaceutical innovation and come up with life-saving treatments. I'm not going to make an argument against that. However, a 39-year patent on a drug that has a biosimilar available everywhere else in the world, like my drug, maybe we're making the argument that at this point they have way more recouped their research and development costs for that drug. That being said, this is fundamentally saying there is no point in developing preventative medication for anything. Like, I want to point out that, like, Tylenol and stuff is on this list of preventative medications that can be covered for certain kinds of drugs and also, like, certain services, like annual OBGYN exams and pap smears and stuff. Like, you could just say, oh, we're not going to cover anything, any new screening criteria, any new medications, because they didn't exist on March 2010, despite the fact that the Affordable Care Act literally came up with a task force that is meant to regularly meet and rate drugs. So anyway, I have so many feelings. Eric says, not only have a lot of drugs come out since 2010, but a lot of diseases have come out since 2010. Yes, a great example is when we had a novel illness that caused a global pandemic, and suddenly we needed to have immunizations available for everyone as a matter of public health. Oh, I don't know, did that happen recently? Oh, did we need antiviral drugs to treat the disease that killed more Americans than anything else in the years 2020 and 2021? I don't know. Interesting. Okay. Sorry. I have so many feelings. Newbold One says, did it exist in biblical times? No. Good. Then we don't have to cover it. I'm not even going to get into that when it comes to abortion healthcare and biblical times because fun facts. Mimi says, you missed the tragic story of the vegan donut shop closed for business. However, I have cupcakes from vegan bakery to help me cope with this very depressing discussion. Oh, I'm sorry about your vegan donut shop already being closed. Well, I don't know if this is going to make you jealous or not, but I think it is time, in fact, for donuts so that we have at least a little bit of relief from this whole situation. All right, so this is the donut. It is a Marionberry on the outside, and then it's got like a cacao nibs on top, and then it's a chocolate cake donut underneath. Regular viewers will know that I really don't like chocolate very much, but I know it's weird, but let's find out how good it is. I'm not tasting the Marionberry yet, but that could be because I don't like chocolate very much, so all I taste is chocolate. It's nice and dense cake donut. It's not like a fluffy donut instead. Oh my god, this is so hard to eat and talk. Nil says 2010, that was like 2 years ago, right? La 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 la. I know how you feel. Let's go. You know, I'm trying to figure out my rating for this. And I think it's a good donut, but I really am not tasting the Marionberry in here. And I pretty much only got it because I was like, I'll have Marionberry. It is just so chocolatey. But if you liked chocolate and you're not like me, it's a great donut. It's nice and crusty on the top, but then it's got a really good bake in the middle. It's so chocolatey that I can't personally handle it. So the question is, do I rate this based on my own weird not liking chocolate? Or do I rate this based on how I feel like someone who would like chocolate would like it? Maybe I give it 2 ratings, because I think it is a 4 out of 5 if you like chocolate. And for me, it's a 2. Jenny, I wish I could send you this chocolate donut, because I probably am not going to finish it. I'll try to eat another bite of it, but that water really helped. It's very hard to eat on camera. It's a 1 out of 5 rating for eating on camera. Oh, I got chocolate on my computer now. Gross. Jenny says, I think it would be a bit stale by the time it got to Quebec. The donut shop here has, like, on their FAQs, people are always asking them if they ship donuts, and they're like, no. They won't even sell day-old donuts at this donut shop. So sometimes when I get donuts the night before, like Breakfast on the Bridges, I have to not tell them because they're, like, morally opposed to eating donuts the next day. They're very obsessed with fresh donuts. Oh, I need water. Does anybody have any questions about this? I can answer a lot of the questions about the challenges from a healthcare perspective. As far as it's moving through the courts and stuff like that, that is a little less my wheelhouse. But I can tell you why it's concerning. And I think I've done plenty of that. But, you know, there's a lot of reasons why it is very concerning. Like in 2021, a physician in the Texas legislature introduced a bill that would give healthcare providers the right to refuse patients' treatment based on their personal beliefs. And like that could be concerning because what if you're in an emergency situation and they find out you're a gay couple and then they decide not to administer healthcare? Like you could see with exceptions for emergency or trauma care, they could say, you know, I think having sex outside of marriage is immoral. Therefore, I won't prescribe you contraception because you're unmarried, which is like how contraception was prescribed for a very, very long time. And women would not be allowed to access birth control unless they were married. So this moralistic sort of, there's plenty of moralistic use and access to healthcare examples we have in the past, and I'm very, very worried we're getting back to it. It could say, I don't want to give you access to PrEP because I think then you'll engage in risky sexual behaviors or intravenous drug use. But in reality, we know that folks that are engaging in intravenous drug use or risky drug use lifestyles, alcoholism, are not dissuaded by giving access to harm reduction tools. They're not, if they are suffering from addiction, if they are engaged in sex work in order to make a living, the likelihood that access to those drugs is going to incentivize that behavior is actually much lower than access to that drugs is just going to save their freaking life. We have no piece of evidence that people are like, oh, I'm going to go out and and engage in risky behavior because I'm on PrEP. For one, PrEP, despite being theoretically covered for $0 cost for the drug under the essential healthcare benefits, which is the thing being attacked, PrEP requires a lot of other work in addition to that. Similar to a lot of hormonal birth control, it has to be taken at the same time every single day. So that already requires like a fair amount of executive functioning. Additionally, it requires liver panels and like regular STI screenings and HIV screenings. So it is important to understand that, like, for a lot of people, PrEP is not because they are engaged in a risky lifestyle. It is because they have very intentionally decided to reduce their risk and exposure to HIV, which in fact is reducing the risk in their lifestyle. Like it takes a fairly high level of functioning to choose to do that. So yeah, it's just very frustrating. New Bold One says, see, that's a harmless moral obsession. Fresh donuts. Yes, exactly. I mean, we could make the argument that my ability to get cheaper donuts is being harmed because I am forced to cover everyone's fresh donuts when I only need day-old donuts. I mean, we can use this logic any way we want, right? All right, y'all. Well, we've been going at it for a while. It's been over an hour of me ranting about this. How about to end this stream, you tell me something positive, something nice that's happened to you this week, something you're looking forward to. I don't know how cute a local puppy was. I don't know. Tell me something uplifting because the news has been very not uplifting, and I thought I would do this stream about something more positive, and then this is all I can focus on is these tiny cases that might very well turn into a big case. And if we don't keep an eye on these things from the beginning, we run the risk of the very fragile, already terrible scaffolding that is the American healthcare system being completely dismantled from underneath our feet already. Anybody got a positive thing? My very special depression robe is going to cost me less money because I chose less expensive materials for it, not intentionally. Ooh, I love the idea of a special depression robe. I have gotten into the like concept of like dressing gowns as a way for feeling very fancy when you're essentially just wearing your pajamas. So I'm on board of that. Jenny says, thank you. That was very informative. My husband and daughter are currently on my husband's dream vacation in Nova Scotia. I am home taking care of the pets. Ooh, Nova Scotia is very, very pretty, but I've always visited like when it's winter, and I've wondered how it is in the summer because I feel like Nova Scotia might be a lot more pretty and a fun dream vacation in the summer. In the winter, it manages to be pretty, but in like a depressing wintry way. So that's exciting. Hopefully taking care of the pets is fun for you and you're glad you're not on the vacation and not just sad you're not there. Mimi says, we came back from camping in Pennsylvania a week ago. It was a great trip. Now I'm preparing to visit my friend in Cooperstown for a week, leaving tomorrow. Look at all that travel. Yes, that is exciting. Ash says, I'm so excited for it. It's the style of the yellow robe from Our Flag Means Death. Okay, so here's the thing. I tried to watch I downloaded all of Our Flag Means Death for the plane. And I got through the pilot episode and I love the robes. The robes are fantastic. So props, great choices. But two, I see why people love it. And I'm like, I like the character developments, but it was too violent for me. So, and it was like too much trauma, at least in the like pilot episode when like processing your trauma, that I was like, I don't think I can be into this, which is really frustrating me because it took a lot for me to decide to watch a pirate show in the first place because my whole philosophy with the whole pirate thing is like pirates are still causing lots of trauma and violence in the world, and I don't particularly like the glorification of pirates, but everybody was like, yeah, but it's very comedic, it's also very gay, has good outfits, and I was like, I do like all of those things. So I tried to watch it on the plane, and I found it was too violent. I don't know if that violence decreases, but it seemed like it seemed like it was gonna keep happening. I don't know. But I appreciate the robes. Ash says that's very fair. Bummer. I was kind of hoping you were gonna be like, oh, the pilot had a bunch of violence, but then it goes away. Mimi says we visit Gettysburg on the camping trip. That place is a really special energy. I learned a lot. It challenged many of my ideas about the past, present, and future of our country. Oh yeah, I haven't been to Gettysburg in years, but I think it would be interesting to think about. I think we've gotten really caught up in what was written down a very long time ago in a very different society in determining what we have decided is good for now. Jenny says his family is from Nova Scotia and they're selling the cottage that was his grandparents. This is the only time he can show his daughter. Oh, that's very sweet. Well, I hope that it's a lovely trip. Nils says, I'm taking the week off to visit family and friends since I feel like I can't carry on another week because I've essentially worked through all the holidays. Well, that's exciting that you're taking a holiday. I'm sorry that you've worked through all of the holidays and that you feel like you can't take it anymore, but I'm glad that you are taking time off. I hope that you I hope you get the rest that you deserve and that it is a very lovely week. Ash says, I feel like it didn't pick up until episode 3 or 4. I don't know if I could get through 2 more episodes of violence to get invested. I liked the homoeroticism though. And outfits. I like period outfits and homoeroticism. And Gentleman Jack got canceled by HBO this week. So now I'm going to have to find another way to get my period costumes and homoeroticism. And like slightly not sympathetic main characters. I'm so frustrated that Gentleman Jack got canceled. And I'm like hopeful that someone else will pick it up other than HBO. But New World One says, I have a new secondhand gaming controller, which I'm hoping will be better for me than my keyboard. Very excited about it. I'm excited for you. I don't really know enough about gaming controllers, but I'm excited that you're excited. Ash says, oh no, the violence continues. Maybe not as gory, but it's there. Yeah, I don't think it's my kind of show. It's like a bummer. What I need is a supercut of just like all of the good costumes and all of the homoeroticism bits and just none of the violence. Like if I could just have the like edited version. I don't think it's around anymore, but there used to be this thing called, I think it was called VidAngel, and it was a streaming platform that edited out like graphic scenes of under different things for parents. So it would let you watch a movie, but then like edit things out. And it was mainly used by like conservative Christians to like edit like a same-sex character out of movies or like kisses out of a movie that their 10-year-old was watching. But I feel like I need the VidAngel, but for violence for Our Flag Means Death. But I have a feeling that VidAngel would not carry Our Flag Means Death. Ash says Tumblr is super good about providing GIFs and pics of the important stuff. Well, I know. That's why I was tempted enough into it, is the amount of GIFs of Our Flag Mean Deaths I saw on Tumblr. I was like, New Bold One says, dang, why can't we have nice things? I don't know. And Ash says, WTF HBO. I agree. Mimi says, we are loving the Netflix show Formula One, watching the very last episode of the last season tonight. What is it about? Is it about Formula One, the like racing? Because how are you going to make cars driving around in a circle interesting? I mean, I know that that's like the entire premise of the whole Fast and Furious like genre. By the way, one of my coworkers did a supercut across like 8 movies in the Fast and Furious season of like 2 lesbian subplot characters. I think maybe they weren't even actually in a relationship. They just like it, like you could easily do an ship edit for them. One of my coworkers did a full ship edit of every single one of their moments across like all of the Fast and Furious franchise, and then played it as their like their sharing thing during the work happy hour. It was great. Mimi says, Reading historical fiction novel about Gettysburg, The Killer Angels, learning about it helps manage my anxiety about the hijacking of patriotism by white supremacists. I think that sounds great. Formula One racing, yes, so much drama among the team and the drivers. I mean, I guess that's the Fast and the Furious franchise. I don't know. I don't know if I could do it. If you feel like reading homoeroticism historical pirates, I can strongly recommend Mackenzie Lee. Okay. I'm not really into the pirates thing generally, but I saw so many GIFs from our flagman's death, and everybody I know was really into it, especially in the historical costuming community. And so I tried it, but it's just not my thing. I don't like violence on screen. I feel like we have enough violence in the world. I don't need to sustain myself for it. I don't like horror. I don't really like violence. And I also have a lot of trouble with animated stuff because I didn't watch animated stuff when I was a kid. And I have a lot of trouble processing like conventions in animated genres. So sometimes I feel sick when I watch animated stuff, which is fine. There's plenty of television in the world for me. Also, I have to catch up because I didn't watch TV growing up. And then I didn't have television for most of my 20s, like every other punk. And then all of a sudden, we all had Netflix and everything, and we all watch plenty of TV. So I have plenty to catch up on, and it's okay. I've still watched all of Buffy the Vampire Slayer, I think twice, at least 1.5 times. And Buffy is violent, but for some reason, I can mostly handle the violence. I think it is because it's like a sanitized 90s network TV version of violence. I just get through it in order to like watch cute girls be badasses or something, and like also their sanitized version of a lesbian relationship they had to do where it was like them doing witch rituals because they weren't allowed to kiss on screen despite being in a relationship and living together, and they'd be like fluffing the pillows on their bed a lot because they weren't allowed to like actually have anything on network TV that implied they were actually lesbians. So yeah. There are many bromances in Formula One racing. You do have me slightly more invested now. Jenny says, I mostly like animated stuff because I have the movie maturity of an 8-year-old. Because I didn't grow up watching TV, I watched like very occasional like PBS at a friend's house. And I watched figure skating, but I did not watch TV growing up. And I, because of that, had to catch up on a lot of like television tropes and stuff. And I actually ended up taking film class in college in order for me to like be able to understand and follow movies, because I just kind of missed out on a lot of that stuff. This was my own, it wasn't my parents really enforcing it. I just had a belief that TV rotted your brain. And so I didn't watch cartoons or any of that kind of stuff. And so I ended up having to watch a lot of those cartoons, like some of those like Looney Tunes and everything. I watched in film class in college, which helped explain a lot of conventions of the genre. Like I would get super confused when I watched movies until I took a film class, because things like, there's just a bunch of film conventions that you might not realize that you understand what they mean. Like one of them was like when someone is looking at a letter and you hear another person's voice reading it, it's a letter from that person. And that like they're reading a letter to them from that person. That kind of stuff would totally confuse me and I'd get completely lost. It's kind of like watching a movie in a language where you like know it okay, but not all the way, and you'll just like miss certain kind of contexts. Like I ended up having to take like a year of film in order to really get a lot of things, but it was very helpful because now I actually see a lot of the conventions in film and television, and I understand like the historical frameworks for them because the film class that I took like started from the very beginning of film. So anyway, but I still do get a little motion sick with some animated stuff. It's hard for me to do animation. Like I tried to watch The Simpsons, and it was like 10 years ago now, so maybe I'm more able to do it now. I tried to watch The Simpsons and I could not. I mean, it was so fast. It was so hard to handle for me. So all right, y'all. Okay, now we've been at it for over an hour, almost an hour and a half. I think we did a great job. Thank you for telling me all your positive things that are coming up or happening right now, because I think we need to end on some positive notes. And I will be back, I believe, yes, next week will be at the normal time. The week after that, I have a lot of stuff going on, like a memorial ride for a friend and stuff. So I may do the live stream at a different time or a different day on July 31st. But yeah, Sunday, 11:30 Eastern time, or 11:30 Pacific time, 2:30 p.m. Eastern time in the States. Thank you all for joining. Stay hydrated, stay safe, pet a cat if you have one available, and I'll see you all next week. Bye. I love it when I'm just like,